Hey everybody, and welcome to another deep dive with us. Today we're going to be exploring an interesting research study about ischemic strokes in dogs.
Okay.
And it was published in the Journal of Veterinary Internal Medicine.
Right.
And get this, it followed 125 dogs
Wow.
over 2 decades.
That's incredible. A treasure trove of data.
I know, right? We're going to uncover some surprising insights about which dogs are more likely to survive a stroke and what factors may not affect survival as much as we think.
Okay.
So we'll be looking at comorbidities, those other health issues that often go along with a stroke,
Right.
as well as long-term outcomes, and even something called post-stroke epilepsy.
Those are all really important areas, yeah.
Yeah. So let's jump right in. One of the first things that stood out to me was how common comorbidities are in dogs who have strokes.
Yeah.
The study found that over 40% of the dogs had at least one other health issue going on.
So it really highlights the importance of looking beyond just the stroke itself. You know, we need to be thinking about the whole picture of the dog's health to understand why the stroke occurred in the first place.
Like detective work?
Exactly like detective work, and some of the most frequent culprits they found were hypertension,
Okay.
proteinuria, and heart disease.
All those things that we kind of, think of as risk factors in people.
Exactly. And they're all conditions that can increase the risk of stroke, so it's essential to identify and manage them properly.
Now, you might think that having a comorbidity would automatically mean a worse outcome, but the study found that wasn't always the case.
Yeah, the overall survival rate was actually pretty good, even in dogs with these additional health challenges.
That's really encouraging to hear.
Yeah, it really highlights the importance of proper management. With the right care, dogs can still live good lives, even with these comorbidities.
Absolutely. Now, another interesting finding was that the location of the stroke in the brain seemed to play a role in survival.
Specifically, dogs with strokes that affected the cerebellum, the part of the brain responsible for coordination and balance, were more likely to be discharged from the hospital.
So that's actually a positive sign. If a dog's stroke is located in the cerebellum, their chances of going home are better.
That seems to be the takeaway from this study, and it might be because cerebellar strokes often cause less severe symptoms than strokes in other parts of the brain.
That makes sense.
Yeah.
Now, the study also differentiated between what they called larger strokes and smaller strokes.
Right.
The larger strokes obviously affect a bigger area of the brain, and sadly, all the dogs that didn't make it out of the hospital had those larger strokes.
Yeah, it underscores the potential severity of those larger strokes and emphasizes the need for prompt and aggressive treatment.
Definitely. Now, another area the study explored was stroke recurrence.
Uh-huh.
They found that almost 20% of the dogs had a suspected or confirmed stroke recurrence, meaning they had another stroke at some point after the initial one.
And what's interesting is that this didn't necessarily mean the dog would have a shorter lifespan overall.
So even if a dog has a second stroke, they could still potentially live a long life.
That's what this data suggests.
Now, this brings us to what I think is one of the most fascinating aspects of the study, post-stroke epilepsy.
Okay.
It turns out that a small percentage of dogs, about 7%, developed epilepsy after their stroke.
This is something we also see in humans, and it's thought to be caused by changes in the brain's wiring after the stroke.
It's pretty remarkable.
It is, and while it sounds alarming, the good news is that most of these dogs didn't require medication for their epilepsy because their seizures were infrequent.
So it's a potential complication, but not necessarily a debilitating one.
Exactly. Now, one of the things that stood out to me in the study was that sometimes strokes are misdiagnosed as something else entirely.
Like what?
Well, they specifically mentioned brain tumors. Apparently, even with advanced imaging like MRI, it can sometimes be difficult to distinguish between a stroke and a brain tumor.
Oh, wow.
Yeah.
I imagine that could have significant implications for treatment.
Absolutely. That's the crux of the matter. The more accurately we can diagnose a stroke, the better we can tailor treatment and management for that individual dog.
Now, I'm also curious about how they determined if a dog had a stroke recurrence. Did they rely solely on what the owners reported?
That's a great question, and you're right to point out that relying solely on owner reports might not be entirely reliable, but the study didn't go into detail about how they confirmed those stroke recurrences.
So there's some room for interpretation there.
There is, and it raises the question of how we can improve the accuracy of diagnosing stroke recurrence in dogs.
Maybe future studies could explore the use of more objective measures, like repeat MRI scans or even video recordings of those suspected episodes.
That would certainly provide more concrete evidence.
Well, before we delve further into those questions, let's shift gears a bit and talk more about the different types of strokes.
Okay.
The study did touch on those different types of strokes
Yeah.
and how the size and location of the stroke can impact a dog's outcome, like how those larger strokes had a much lower survival rate. I also remember reading that the study looked at something called disability scoring systems.
Yeah.
Can you elaborate more on that?
Sure. So the study suggested that simply looking at whether a dog regained the ability to walk after a stroke might be too simplistic a measure of recovery.
Okay.
There could be other more subtle deficits that affect a dog's overall well-being, even if they can walk again.
So how do you measure those more subtle aspects of recovery?
That's where these disability scoring systems come in. They provide a more comprehensive evaluation of a dog's neurological function.
So instead of just a pass or fail on walking, you get a more detailed picture of how the dog is doing overall.
Exactly. These systems take into account things like coordination balance, mental alertness, and even subtle behavioral changes. They allow for a much more nuanced assessment.
And that kind of detailed information could be really helpful in tailoring treatment plans, right?
Absolutely. It allows veterinarians to track progress, identify potential setbacks, and adjust treatment as needed.
Now, we talked earlier about how the study relied on owner-reported information, particularly when it came to stroke recurrence. Did they mention anything about how we might get more reliable data on that?
They briefly touched on the idea of using more objective measures like repeat MRI scans. But, of course, that's not always feasible.
Especially for older dogs or dogs with other health complications.
Right. But even simple things like video recordings of those suspected episodes could be helpful for veterinarians in determining whether it truly looks like a stroke recurrence.
That's a great point. And it underscores the importance of clear communication between pet owners and their vets. The more information a vet has, the better equipped they are to make informed decisions about treatment.
For sure.
Speaking of communication, the study also mentioned that properly characterizing epileptic seizures in dogs with post-stroke epilepsy is crucial. I imagine witnessing a seizure in your dog can be really frightening, and it might not be easy to accurately describe what happened, especially if you don't know what to look for.
Absolutely. That's why the study emphasized the importance of using objective measures like electroencephalography or EEG.
And EEG is basically a brainwave test, right?
Exactly. It allows us to monitor the electrical activity in the brain and identify those telltale patterns that are characteristic of seizures.
But an EEG is probably not something readily available at every vet clinic, is it?
That's true. It can be expensive and requires specialized equipment and expertise to interpret the results.
So what can be done in the meantime? Are there other ways to improve accuracy in identifying seizures?
Encouraging owners to take video recordings of any suspected episodes is incredibly helpful. It gives the veterinarian something concrete to analyze and helps them determine whether it's truly a seizure and if so, what type.
So documentation is key. Now, the study noted that post-stroke epilepsy in dogs seems to occur at a similar rate to humans, around 8 or 9%.
Right.
But they didn't go into a lot of detail about the specific causes.
Yes, that's definitely an area that requires further investigation. That's the burning question. In humans, we know that a number of factors can influence the development of epilepsy after a stroke, like the size and location of the stroke, the presence of scar tissue in the brain, and even genetic predispositions.
So it sounds like there's a complex interplay of variables at play.
Exactly. And understanding how these factors translate to canine patients will require more targeted research.
Now, they did mention that only a small number of the dogs in the study actually needed medication for their post-stroke epilepsy.
Right. And that was primarily because their seizures were relatively infrequent.
But for those dogs that DO need medication, are the treatment options similar to what we use in humans?
To some extent, yes. Medications like levetiracetam and gabapentin, which are commonly used to control seizures in humans, are also used in veterinary medicine.
But I imagine there's some important differences when it comes to dosing and potential side effects.
Absolutely. Dogs metabolize medications differently than humans, so careful monitoring is crucial. It's not a one-size-fits-all approach. Each dog needs to be evaluated individually, taking into account their specific needs and medical history.
Yeah, I'm curious about something else mentioned in the study. This idea that even with medication, some dogs with post-stroke epilepsy didn't become completely seizure-free.
That's an important observation, and it highlights the fact that managing this condition can be challenging. It's not always as straightforward as just giving a medication and expecting the seizures to disappear completely.
So what can we do to improve outcomes for these dogs?
I think the key is further research. We need to understand more about the specific causes and triggers of post-stroke epilepsy in dogs. The more we know about the underlying mechanisms, the better we can tailor treatments and potentially develop new therapies that are more effective.
The study really focused on those strokes caused by a blockage of blood flow to the brain, which are known as ischemic strokes. But they didn't mention anything about the other type of stroke, the one caused by a blood vessel rupturing in the brain.
That's right. Hemorrhagic strokes, as they're called, can be just as devastating as ischemic strokes, if not more so.
And since the study didn't include any dogs with hemorrhagic strokes, we don't know how those might differ in terms of comorbidities, outcomes, or the development of post-stroke epilepsy.
Exactly. That's an important area for future research.
Now, getting back to ischemic strokes, the study found a significant association between certain comorbidities and the risk of stroke, like hypertension, which is high blood pressure, and proteinuria, which is protein in the urine.
Those were two of the most common comorbidities they found, and both have been linked to an increased risk of stroke in dogs.
The study mentioned that the link between hypertension and stroke in dogs isn't fully understood. How does high blood pressure actually lead to a stroke?
Well, one theory is that chronic hypertension can damage the lining of blood vessels in the brain, making them more susceptible to the formation of clots.
And when a clot forms, it can block blood flow to a portion of the brain, causing an ischemic stroke.
Precisely.
And what about proteinuria? How does that increase the risk of stroke?
Proteinuria is often a sign of underlying kidney disease, and kidney disease can increase the risk of blood clots forming throughout the body, including in the brain.
So it's a red flag. If a dog has proteinuria, it warrants further investigation to determine the underlying cause.
Absolutely.
The study also found a surprisingly high number of dogs with a heart condition called myxomatous mitral valve disease, or MMVD.
Yes, MMVD is a common heart condition in dogs, particularly in certain breeds.
And it affects the heart's ability to pump blood effectively.
Exactly.
While the study didn't find a direct link between MMVD and a decreased lifespan in dogs with ischemic strokes, it does seem like the connection between heart health and stroke risk needs further exploration.
I agree, it's an area that warrants more research.
Now, another interesting term that came up in the study was hypercoagulable state. Can you explain what that means?
A hypercoagulable state means that a dog's blood is more prone to clotting than normal.
And what causes that?
It can be caused by a number of things, including underlying health conditions like kidney disease or certain types of cancer. It can also be triggered by medications or even certain infections.
So there are a lot of potential culprits.
There are, and identifying a hypercoagulable state is important because it might influence treatment decisions. For example, a dog with a hypercoagulable state might need to be on blood thinners to reduce their risk of further clotting.
That makes sense. Now, we touched on this earlier, but the study found that certain breeds, particularly Greyhounds and Cavalier King Charles Spaniels, were overrepresented in the sample of dogs who had strokes.
That's right, and it raises the question of whether there's a genetic component to stroke risk in dogs.
Could certain breeds have inherent predispositions to conditions like hypertension or heart disease, which could then indirectly increase their risk of stroke?
That's certainly a possibility, but we need more research to confirm that.
It would be fascinating to unlock that genetic puzzle. Now, the study didn't really touch on the role of diet or lifestyle factors in stroke risk. We know those things play a big role in human health.
It's true, the study didn't delve into those areas, but it's certainly plausible that factors like obesity, lack of exercise, and even certain dietary components could contribute to stroke risk in dogs.
So things like maintaining a healthy weight and ensuring your dog gets regular exercise could potentially be important preventative measures.
That's the thinking, although more research is needed to say, for sure.
Now, we talked earlier about how ischemic strokes can sometimes be mistaken for brain tumors.
Right, and that really highlights the importance of advanced imaging techniques like MRI in differentiating between those conditions.
So even with MRI, there's still room for error.
There is.
That's concerning. What can be done to improve diagnostic accuracy?
I think it comes down to a couple of things. First, we need ongoing research into even more sensitive and specific diagnostic tools. There may be other biomarkers like blood tests or even genetic markers that could help us identify stroke more accurately.
And the second thing?
The second thing is expertise. Even with the best technology, it takes a skilled veterinary neurologist to interpret the findings correctly and make an accurate diagnosis.
So it's not just about the tools, it's about the people using them.
Exactly. That's why it's so important for pet owners to seek care from a board-certified veterinary neurologist if they suspect their dog might have had a stroke. You want the expert on the case.
Absolutely. Now, the study didn't go into a lot of detail about specific treatment options for ischemic strokes.
That's true, but generally treatment focuses on a few key things. First, you want to address the underlying cause of the stroke, if possible.
So if the stroke was caused by a blood clot, you might use blood thinners to try to break up that clot.
Exactly, and you also want to manage any neurological deficits the dog might have. This might involve things like physical therapy or medications to control seizures.
And of course, preventing further complications is crucial.
Absolutely, so it's a multifaceted approach, really.
Early intervention is key, right? The sooner a dog receives treatment after a stroke, the better their chances of recovery.
That's what the research suggests.
Now, we haven't talked much about rehabilitation therapies, but I know those play a big role in helping human stroke patients recover.
They do, and while the study didn't focus on rehabilitation, I think it's becoming increasingly recognized as an important part of stroke recovery in dogs as well.
What kind of therapies are we talking about?
Things like physical therapy, occupational therapy, and even acupuncture have all shown promise in helping dogs with neurological conditions regain function and improve their quality of life.
So these therapies can help retrain the brain and body to work together after a stroke.
Exactly.
Now, I know this is a research study about a serious topic, but I have to say, I was struck by the overall optimistic tone.
Me too, and I think that's really important for pet owners to hear. A stroke is a significant event, but it doesn't necessarily mean the end of the road for a dog. With prompt and appropriate care, many dogs can go on to live long and happy lives. It's a message of hope.
It is, and it underscores the importance of continued research in veterinary neurology. The more we learn about these conditions, the better equipped we are to help our canine companions.
Well, I think we've covered just about everything in this deep dive on ischemic strokes in dogs. I'd love to get your final thoughts on this study as we start to wrap things up here.
Yeah, well, it was a monumental undertaking to follow so many dogs for such a long period.
Right.
And I think it's given us just a wealth of knowledge about ischemic strokes in dogs.
It really has.
And I think one of the key takeaways is that while a stroke is a serious event, it's not necessarily a death sentence.
Yeah.
With proper management of any underlying conditions and attention to the individual dog's needs,
Right.
many dogs can go on to live happy and fulfilling lives after a stroke. What are some of the unanswered questions, though, that you think this study highlighted?
Well, one area that I think needs further investigation is the role of genetics in stroke risk for dogs.
We talked earlier about how certain breeds seem to be more prone to strokes.
Right.
Could there be a genetic predisposition at play there?
It's certainly possible, and that's an area that's ripe for further research. If we can identify specific genetic factors that contribute to stroke risk, it could have a huge impact on breeding programs.
Right.
And even early screening tests for dogs.
That's a really exciting prospect.
Yeah.
Another question that wasn't fully addressed in the study is the impact of diet and lifestyle on stroke risk.
Yeah.
We know those factors play a significant role in human health.
Yeah.
Could they be just as important for our canine companions?
That's what we need to find out.
It would be interesting to see future studies explore the link between things like obesity, exercise, and diet, and the risk of stroke in dogs.
I agree.
We also talked about the challenges of accurately diagnosing stroke, especially when it comes to differentiating between a stroke and a brain tumor.
Right.
Even with advanced imaging, there's still room for error.
There is, and that's why we need to continue pushing the boundaries of diagnostic technology.
Could there be other biomarkers that could help us identify strokes more accurately?
That's a great question, and it's something that researchers are actively exploring.
Maybe one day we'll have a simple blood test that can tell us definitively whether a dog has had a stroke.
That would be amazing.
Wouldn't it?
Yeah.
We also touched on the potential benefits of rehabilitation therapies for dogs after a stroke.
Right. That's an area that holds a lot of promise.
I imagine those therapies could be instrumental in helping dogs regain lost function and improve their overall quality of life.
Absolutely, and the earlier we can start those therapies, the better.
It's all about giving the dog the best possible chance of making a full recovery.
Exactly.
Well, as we wrap up this deep dive into ischemic strokes in dogs, I had to say, I'm feeling a sense of optimism.
Me too.
The research is progressing.
Yeah.
And we're learning more and more about how to prevent, diagnose, and treat these conditions.
Absolutely.
And that means better outcomes for our furry friends.
For sure.
I want to thank you so much for joining us on this journey of discovery.
My pleasure.
Remember, knowledge is power, especially when it comes to the health of our beloved pets.
It's been a pleasure sharing this information with you.
And to all of our listeners out there, thank you for tuning in. Until next time, from Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging.